today's presentation and the conversation, more importantly, you're going to have, I hope, is about giving us a sense of confidence about where we're going to go and the difference we're going to make. Integration is a part of the bigger picture. The bigger picture, I think, really in terms of where Scotland is going as a nation, in terms of public service reform, the health and social care agenda is part of it. This government's not hanging around. It said in its manifesto it was going to make reform in terms of health and social care, police and fire and colleges. They have achieved it in police and fire in 1 year. The bill is going through the Parliament now for health and social care integration. The first stage of the committee stage of the bill will be concluded by the end of November, next 2 or 3 weeks. So the legislation is changing. So there's some ways for us the challenge is about what we want those changes to be here in Fife. But it is part of a bigger, wider overall change.
We all know about the demographic trends, and I'm not going to rehearse those arguments. And we all know that some of the same that we've been doing won't do. We can't do more of the same. We need to find different ways and better ways of working together. And the evidence tells us that working more effectively together will help make that happen. And the legislation kind of accelerates that process. We have in Fife been working well together in the agencies, but the legislation is going to force us to join up budgets and have different arrangements to kind of accelerate that working together process. Delighted to be here today as part of this important event for third sector and independent sector care providers.
I'm glad to see today that we've got as many provider independent sector of the third sector plus health and social care. It's so important that we get the right care at the right time and the right place for the people of Fife, and today is one of these events that will bring that together.
Attending the health integration seminar today for providers has been very helpful, because obviously the key to a successful service is partnership working, and it's an opportunity to meet with others, share ideas and hopefully take away some learning which we can bring back to our organisation to improve our service.
I'm here today really to try and have input and find out more about the proposed integrated care programme. We believe that that there is a need for more integration between the different service providers and the councils who purchase care, and also to try and hopefully inform the process of how all the providers.
I'm here today because we're interested in integration of the health and social care, and also we'd like to improve partnership working between all the sectors. Today I've enjoyed talking to the councillors, hearing the introduction speeches from Rona Lang, Joan and Stephen Moore. It was very good and very positive, and I hope that we can take a lot of partnership working ideas away from this.
I'm absolutely delighted to be part of today, and not only to put a face to a name in many situations, but also to hear what the aspirations are for Fife Council and NHS Fife, and to see where our involvement as the independent sector, how we can get involved, how we can help reach these aspirations, and take things forward in order to get better outcomes for the people of Fife.
I'm here today to hear how things are going in Fife, the ideas people have as we move forward into integration, self-directed sport and the new policy arrangements. And I'll be leaving here very excited about the day. People have had really good conversations. They've actually identified things they want to take forward. The initial presentation by Stephen Moore the integration director, was extremely helpful in giving people an understanding of the broader picture and the challenges we face.
The reason I'm here today is to find out just what kind of commonality there is between the providers and the users in the integration of health and social care, which will allow me to go back and feed that information into my colleagues who work with people on a one-to-one basis.
I've really enjoyed the event today. It's been a great opportunity to participate in sharing views and helping take integration forward in Fife. And it's been a great opportunity for networking with other colleagues.
The discussion around the table I've been at has been very positive, very constructive, and I'm sure that Fife will be well set to integrate services and make sure that the individuals in Fife are looked after the way they want to be.
I'm here today because I'm very committed to the integration agenda. I think today's a really good opportunity for the different partners to come together and explore how we really make this work for Fife, how we take things forward very positively and in an atmosphere of co-production. I think the idea of us all working in partnership is really, really crucial to how things move forward in Fife.